So good morning or good afternoon, depending on where you are. So thanks again for joining our webinar about autism spectrum disorder, the key to supporting challenging behavior. My name is Yong-Soo Park, a scientist and assistant professor at QBRI in HBKU. So today I'll be moderating webinar, and I'm glad to welcome all of you. Let me briefly introduce the QBRI Autism Research. The Neurological Disorder Research Center, the NDRC at QBRI, focuses on the research in neurological disorders and autism spectrum disorders to elucidate the molecular mechanisms for diagnosis and therapeutic interventions. We have three major projects to tackle and address ASD at QBRI. First, we are studying the epidemiology and genetics in autism. Second, the modeling ASD using the stem cell technology and organoid. Third, we are also developing biomarkers and early diagnosis using eye tracking and plasma blood sample, and therapy for ASD using monoclonal antibody and nanobody. NDRC at QBRI is developing an international center of excellence from basic to applied research and impact not only here in Qatar, but to the surrounding region and international world. So as you know, the ASD, the autism spectrum disorder, is a neurodevelopmental disorder characterized by the social interaction deficits and language difficulties and restricted and repetitive behavior. ASD affects around 1%, so 1 every 87 children in Qatar, leading to the significant public health and financial burden and stress on parents and family. So today, our three guest speakers will discuss the ASD and how it affects individuals from childhood to adulthood, in addition to providing audience with strategies on how to be helpful when supporting challenging behavior. So our speakers will also discuss the latest in ASD research and the prevalence in Qatar. So first speaker is Dr. Fuad Al-Shaban, who is a senior scientist at QBRI. Dr. Fuad Al-Shaban graduated from the Baghdad College of Medicine, and he became involved in the field of preventive medicine. He obtained his PhD at Royal College of Physicians, Ireland in 1981. He was a research program manager and senior research coordinator in the Washington Hospital Center in association with Johns Hopkins University Hospital. He was a head of Department of Research and Training at the Shafala Medical Genetics Center, where he was involved in setting up research policies and regulations, as well as the establishment of institutional review board. Currently, Dr. Al-Shaban works as a senior scientist at QBRI's Neurological Disorder Research Center. So for your information, your microphone remains muted during this seminar, and then just please leave your questions on Q&A section, not in a chatting section. So all our speakers will answer your questions at the end of our seminar. And then please join me welcoming Dr. Al-Shaban. Actually, Al-Shaban, the floor is yours now.
Okay, hi everyone. What I'm going to talk about first about the autism spectrum disorder in general, then I'm going to talk about what we are doing at the Qatar Biomedical Research Institute. So as you know, autism spectrum disorder is in neurological disorder characterized by the deficit in communication and reciprocal social interaction, and restricted repetitive patterns of behavior and interests or activities. And these features should be presented during the first 3 years of life and causing a significant impairment on daily life. Of course, if we want to go into details, we can see the impairments in the nonverbal behavior, eye gaze, facial expression, body posture, etc. And also regarding the restrictive behavior like motor stereotypes, repetitive behavior, narrow interest, rituals, routines, preoccupation with parts of objects, etc. And usually, autism rarely comes alone. It usually has so many comorbidities, the most important of which intellectual disability, where 50 to 70% of those affected with autism, they have the intellectual disability in one degree or another. Also, epilepsy, around 20% of them will be affected. ADHD, 50% of the autistic, they usually have ADHD. And also there is sleep disturbance, there is immune dysfunction, gastrointestinal dysfunctions, motor problem, social anxiety, and so many other comorbidities.
Dr.
If
Fawad,
we,
Dr.
yeah,
Fawad, sorry,
yes,
are you now sharing your slide now?
yeah, it's in sharing. So it's not.
But we couldn't see your slide actually, the sharing.
Why is that? But okay. So does this mean I need to
Mr.
go
Omar,
back?
Mohammed,
Yes,
do you have any idea?
yes.
Yeah.
Dr. Fuad, did you go up
Yes.
to the menu and share and application and then your slides, please?
Okay. I thought it's okay. Share. So it's okay now?
Yeah, it's now starting to share your content, your slide.
Okay.
Yeah.
Okay.
Now we can see your slide. Thank you.
Okay. Okay.
Just
You're welcome.
please, Dr. Fuad, use the full screen, the presentation mode. Thank you.
Slide shows.
Okay. So as we mentioned before, the causes of ASD, the environment and the genetic factors play an important part. The interaction between these two will induce a neurobiological pathologies, and this will result in autism. And if you could see, there are so many different factors regarding the genetics and the environmental factors. I'm not going to go into details of this. And the other important is screening and diagnosing of autism spectrum disorders. Of course, the family will first notice something going wrong with their kids, whether immediately after birth. It depends on the severity and the state of the ASD in their kids. So usually there are certain points the family should notice, and if they found something wrong in their kids, they should seek for advice, whether from the primary physician or family doctor, etc. These are sometimes we call them the red flags. The red flags includes no babbling or pointing or other gesture by 12 years, no single words by 16 months, no two-word spontaneous phrases by 24 months, or sometimes loss of language and any acquired skills. And this will happen in the regression type. Usually it starts around 2 years of age to or 18 months of age of the child. Now, what the family do, usually they should take their kids to the primary care physician, and if that physician has any concern, he will administer ASD screening instruments, one of the ASD screening which we are going to mention later. And they will, if the screening results positive, they refer them for further investigations and further diagnostic tools to be used. The main ASD screening tools, we have, the chat, which is an old one, then the MChat, the modified checklist for autism, screening tools for autism in 2 years. But the most important one, which is used, the MChat and the social communication questionnaires. Sometimes also we use the CARS, or what we call it, Childhood Autism Rating Scale. The diagnostic tools, of course, the diagnosis of ASD depends on what we call it, the DSM-5 criteria, which is these criteria, we usually apply it in any diagnosis of ASD. The tools to apply these diagnostic DSM-5 criteria, we have the most important one, or what we call it, the golden diagnostic tools, is the ADIR, or Autism Diagnostic Interview Reviewed. And also the other one, the most frequently used, is the Autism ADOS-2, or the Autism Diagnostic Observation Schedule. The ADIR usually takes around 3 hours. It's 92 questions to be asked to the mother or the father, while the ADOS will take around 40 to 50 minutes. In this case, we will observe the child with his mother or father, and we will usually have 10 schedules to interact with the child, and we will observe his behavior during that period. Then we will score each schedule, and the total score will be, depends whether he has ASD or not. But the last one, and the most important one, even when we do the ADIR, the MChat, the ADOS, the last decision is for a committee or the team, would they do a full evaluation and ascertainment of the child and decide whether he has autism or not. Then I will touch very fast on regarding the treatment option. The treatment options, we have 4 main options: behavioral and communication approach, which includes behavioral therapy, speech therapy, occupational therapy, then the dietary approach, and medications, and complementary and alternative medicine. My colleagues going to touch part of these important approaches. Now, the autism research projects at QBRI, we have the main project, which is done by now, is the Autism Prevalence project. And we have also the Autism Genetic Research project. It's an ongoing project. We have the Autism Eye Tracking project. We have the Autism Biomarker Research project. Then we have the effect of COVID-19 on autism project, grown-up individual with autism, which is gonna start, inshallah, very recently. And the last one, we have the digital phenotyping for social communication behavior in autism research. This is actually in collaboration with Rush University, and it's supported by Argos Cognitive Company. I mean, the financial support through that company, and it's recent one. We hope that we will start with this project next month. Just to give you an idea about the prevalence study, what we found, as we mentioned, the prevalence rates we found in Qatar, and it's the first study done in the area. What we did, screening of 93 primary schools in Qatar, and it includes more than 9,000 students screened by social communication questionnaires. After we translated to Arabic and validated it, and also the review of all cases diagnosed with ASD between the ages 5 to 12. And the rate, we found the rate 1.14, which means that 1 in 87 individual between the ages 5 to 12 affected with ASD, whether they are attending the mainstream schools or whether they are, attending special centers. And this same rates, we found the same rates among those who are already diagnosed. Of course, we did that in collaboration with Cleveland Clinic and Oregon Health and Science University Professor Eric von Bohn. Among the other findings, very interesting, it's most of the cases diagnosed between 2 to 3 years of age. And almost 90% of those diagnosed with ASD in Qatar, they are between the ages 2 to 5. This means that the care or provision for the ASD, it's significantly better than so many areas. I mean, if you compare these results, even with the United States, it's almost very similar to what we found in the USA. The other interesting findings is the effect, the role of consanguinity. So many researchers and even families and scientists think that consanguinity do have an effect on the rate of the prevalence or the occurrence or the prevalence rate of autism. What we found that consanguinity has no effect on that rate. And as, scientifically, because of the heterogeneity of the disorder, this is a very, very obvious. But what we found that the comorbidities, or what if we can say the severity of ASD among consanguineous families is higher than the non-consanguineous. And this is a very interesting finding. Also, if we see the numbers of cases with ASD between the ages 5 to between ages 1 to 20, we have around 4,791 cases. Among those, 29% of them Qataris, which means that 1,400 affected in that age group. And if we expand the age limit to 29, the number, of course, increased to almost 13,000, and among them 3,750 Qataris around. Also, during that project, we created the Qatar Autism Registry data. It's around 110 different variables for each case diagnosed with ASD. The number of the registry, we have 1,300, and we are working to expand it. In our next project, the grown-up with autism in Qatar, we are going to include those 13 years and above. The eye tracking research project, this is a very innovative project. We did it in collaboration with Cleveland Clinic. And as you can see here, we can test children as young as 6 months. This boy is almost 6 months old, and he's looking on certain stimuli, audio-visual, very short. It takes around 8 minutes. And the device, if you could see it under the screen, will follow the movement of the eye and will show us whether this kid's going to be affected with ASD or not. It's a very promising, and the accuracy of this test is almost up to 86%. And you could see, I mean, what we did, we translated the stimuli to Arabic and we validated it, and the results was here. If you could see, each dot, it's the eye of one participant. These are the typically developed kids, and most of them, if you see, they are looking at the face, which we call it the social part of the stimulus. While compared to the autistic, if you could see, most of them, they are looking around what we call it the non-social part of the stimulus. And here, if you have a look at the results of the validation, it's amazing. It's almost the same as what the Cleveland scientists found. Now, I will leave the floor to my colleagues. Thank you very much.
Thank you. Thank you, for, Dr. Fuad Al-Shaban, for your nice presentation. I hope, I mean, all you enjoyed this very interesting presentation given by Dr. Fuad. And our next speaker is Mr. Musa Abdelmajid, and he is a consultant and program head of Qatar Autism Association. His experience is in the field of rehabilitation services and therapeutic services, which are part of the teams working with disabilities, childhood through adulthood. So welcome, Mr. Mohammed.
Thank you, Dr. Park. Thank you very much. I just want to share the presentation with the people. Omar, if you give me the share. Yes, so. Yes, here we are. Okay, welcome everybody, and I hope that everybody can see the slideshow.
Yes, yeah, we can see your slide.
Okay. So today I'm going to elaborate also on Dr. Fuad Shaban presentation regarding the autism. We will not go through the definitions and such things, but the prevalence really was astonishing from his study. Remember, 1 out of 87 children from the population. However, the services in Qatar, I'm going to talk in general about the services here in Qatar, and we will go through Qatari Autism Society, which was established about 3 years ago, which is the platform for families and children or persons with autism and their families here in Qatar. After establishing, I'm talking about Qatar now, we have a lot of, all of the ministries in Qatar are involved in the services regarding the services for ASD. The first will be the Ministry of Public Health, which is under that there is PHCCs, primary healthcare centers, and there is HMC, Hamad Medical Corporation, with Andromeda Hospital. We have there a CDC, and to be honest, e-learning also now being launched for the families and for the professionals through Ministry of Public Health. Ministry of Public Health actually had done a haste improvement and movements towards ASD services in Qatar, as well as other ministries like Ministry of Education will come to that. So one of the development happens that all of our PHCCs now using MChat, as Dr. Fuad mentioned, as a tool for like early bird, early red flags to identify autism. And one of the big improvements also was in like now the design of all the health centers in Qatar as a construction and building is autism-friendly designs. However, Ministry of Health start with early intervention from 0 to 6, which we have early identifications, diagnosis, and there is parent supports, individualized family plans, interventions, ongoing health follow-up, and transitional supports, which is will be the responsibility of primary health care in MOPH, and public and private actually providers. School age, which is the Ministry of Education, and the recognition of diagnosis, collaboration with Ministry of Education and Ministry of Health, and the Department of Mental Health Wellbeing and Ministry of Public Health, allied health education, supportive services, all of the transitional supports. And adulthood, which is above 18, here we come to another sector, which is a Ministry of Administration, Development and Labor and Social Affairs, Ministry of Social Affairs in general in other countries. This is the collaboration between them. And this is one of the examples of the autism-friendly environment. All of the centers, this is a kind of health center, a primary health center, which helps in a neighborhood or area. They give all of the let's say services there, medical and other, and they have social workers, they have and now we started kind of a clinics for and I mean clinic for therapy like speech and such things. We are towards this in the coming future, I hope. Ministry of Education, they have public schools, or typical children's schools they call it, and they have actually designated newly, recently, about 3-4 years ago, special education and giftedness department. And this department, under that, there comes kind of a center for evaluation and diagnosis. It's called RUA. And Al Hidayah School, they are kind of mainstreaming schools under the Ministry of Education. And the private sector schools, which we really lack cooperation and lack of some policies and laws there. We will come to that in the next 2-3 slides. However, Ministry of Social Affairs, ADLSA, they have family affairs, they have society department and other departments. I just try to summarize and conclude the services that under this umbrella, which we are, QAS is under society department, إدارة الجمعيات in Arabic, association directorate or department. QAS is a non-profit social society failed or affiliation under this department. However, other ministries are like sports and youth, financial, interior, societies in general have some services here and there, extracurricular, gyms. All of these people are really now trying to cooperate with us and have some partnerships. Well, this is now we will move to our umbrella here, which is the Qatari Autism Society, which is the main or the only platform actually represented the, let's say, people, children with autism and their families. And what do you mean here? Children doesn't include only the early birth ages like 3 or 6. No, we mean the whole continuum. And also adults with autism, we mean that. And their families. And to be honest with you, here we have kind of 3 pillars we do our services there. In between 2 brackets, we are not a service provider more than we are as an advocate and policy and strategy makers trying to do that. So we have 3 pillars to work on, children with autism or with ASD and adults, I mean families, and we have professionals, and we have the society at all. So regarding that, we have a lot of activities and services here and there. We now have around 3 years of establishment, more than 500 activity, and maybe more. It's just a roughly number. And we have now sure more than 600 membership individuals, which indicates the numbers that Dr. Fuad was talking about. Really, we have a big number, a massive number of autism in Qatar and in Arabic region. We have a chair boards, 7 members. All of them are mothers and fathers of children with ASD. However, our programs and our services comes under like education and rehabilitation, like these two programs mentioned here. You Complete Us, which is for early intervention, 3 to 14 years. And there is NIGDR. NIGDR means we are able to do in Arabic, which is mainly designed for vocational training for those who are above 14 and 15. We have awareness training and workshops, a lot of these, hundreds actually we do, but we need to do more because the society still needs more awareness and more to accept. Social activities like field trips, discounts in outlets with businesses here and there, private sectors, extracurricular programs like swimming, and we will come here to it. We will talk about it. This is one of the programs, which is You Complete Us. That's what we call it. We consider autism as a puzzle and circles. We integrate and comprehend each other in our services. So the society will complete us, will complete these children. We provide here, as I said, we are not service providers, but we found out that we need more, let's say, services for the children, at least in early intervention ages. So this program was designed to give speech therapy, occupational therapy, behavioral therapy, and special education. According to COVID, unfortunately, we stopped and we hold on. We are waiting still to go further, we hope, and pray to Allah subhanahu wa ta'ala to move ahead. Vocational, which is NIGDR, this is one of our biggest programs, still running, but as individuals. And we do that for the people who are individuals who are above 14 and 18 years old, which comes under the citizenship. Let's say we are trying to move ahead also in these services. Swimming was not designed just to have fun or to have, no, it was designed to have kind of life skills, how to save yourself. Children with autism have, resistance for routines, resistance for a lot of things. So we tried to do, we've been doing that before even the QAS was established. So it's about 10 years now. However, we are also now holding on because of the COVID-19. Other programs, we have equestrian. Wow, this is a real life, really picture from the one we have in 2019, also for equine and equestrian programs here in Qatar. Regarding the training, we said as professionals, it is the second pillar, second main course. We have training and professional developments. In-house training, like one-day training or a lecture staff training. Outside the training, like awareness for families, medical lectures about epilepsies, medicines, and we've done a lot of these things. Continuing education and training still we have, and we have a kind of resource, small library for professionals and for families if they like the PICS one, we will talk about it in a minute. Outside the training, we do for schools, for organizations. We are trying to make our services holistic as to advocate these individuals with autism spectrum disorder and their families and the society dealing with them to make it more acceptance. One of the international courses, it's about 9 to 12 actually workshops. The number here is not right, it's more. PACS, Picture Exchange Communication System, which is one of the ACCs used to communicate with autism spectrum disorder cases. We have level 1 and level 2. We have FABA, Functional Applied Behavior Analysis, and combined with PECS, how to use these strategies to work with them. Speech, moving from speech to generating devices, speech generating devices. Other courses also was done locally and internationally. This is pictures talks, one picture worth 1,000 words, as the Chinese proverb says. This is one of our activities with Hamad, with families, HMC, Hamad Medical Corporation. This is Dr. George from Qatar University, IT Sciences, using robots to deal with, using smart actually, because now you see the whole society is turning smart, and we are now online. So we try to do a kind of connecting the people and their families and the children, the people with the ASD, with last updated technologies here in Qatar. Horse riding, again, this was a real activity in Al-Shaqab, which is one of the institutions and facilities related to Qatar Foundation. Mothers, also we don't forget mothers and girls with autism. Our programs are for that. Early intervention, one of our most, let's say, supportive programs. This is some pictures, just pictures to show you what we have in Qatar Autism Society. Pictures again. Fun days for girls and boys. We do a lot of art activities for them. You know, most of them like art, and maybe our colleague Alicia will talk more about that. Fun days for families was McDonald's, and there is a kind of ranch here called Baladna. We went there for maybe 3-4 times. Aqua Qatar, Aqua Park, all of these activities, again with the courses. Girls, this is girls, mainly girls. No men is allowed or are allowed to go in this lecture. It was in 2019, 2020. We hope that we could do more and more. This is an awareness for mothers' experience. We also have the benefit from the mothers under our umbrella membership to talk about their experience. And today we have another seminar with the Ministry of DLSA here in Qatar. And one of the mothers was co-presenting with me regarding her experience with Amir, her son. Ministry of Public Health, we have every year we have forum regarding the awareness of ASD. Finally, I think this is my last, really accept and support and cherish all people with autism, not only for today, this is our message, but for the rest of their lives. So we don't have to celebrate 1 week in the month, which you see how much we are rushed. Dr. Fuad is in Washington, Dr. Park here in Doha, Miss Alicia in New York, and so many activities are happening in this week and this month, which is April. Yes, we encourage and support that, but we believe that we really need to celebrate every day. As we said, and this is the proverb that we are always taking under consideration, we are not different, but we think differently. So acceptance should be as a lifestyle for all of us. It's not just for 1 day in the year or the whole year. We should celebrate all around the world that we are not different, but we think differently, which is really ASD. Thank you very much, everybody, and I hope I could really give a good idea about services in Qatar and QAS, Qatari Autism Society. It's my honor to be with you today. Thank you, Dr. Park.
Thank you, Musa. Thanks a lot for your very impressive and emotional presentation. Very nice.
Thank you very much.
And just for your reminder, the audience, so we're gonna have Q&A sessions at the end of today's webinar. So please leave your questions in the Q&A part, the right below of your the screen. And let me introduce the last speakers, Miss Alicia Eid. She's a senior family support specialist of the Autism Project organization. She works as a family support specialist at the Autism Project, where she provides training and consultation to both professionals and parents. She's also working with the Public Safety Special Needs Coalitions, which is a nonprofit she co-founded in 2019. She serves as the autism and mental health specialist alongside a team of police, fire, and rescue personnel. So welcome, Ms. Yard.
Thanks for having me. I was actually enjoying the information about the Autism Society and what they're offering in Qatar. I am fortunate enough that I get to work alongside the Autism Society here in Rhode Island, and they actually offer some similar programs. So what I'm going to be talking about today is some changes that have happened over the last couple of years with regard to how we work with challenging behavior. So as Dr. Fouad said, one of the things with autism, it is a neurological developmental disorder. So it is a brain-based disorder. What we find, right, a lot of times my role is I go and work with professionals or parents when they have challenging behavior with one particular student or child, or if they're looking to develop an autism-friendly classroom, we go in and we help support that. A lot of times what we find is the strategies that are typically used when working with individuals with autism are geared towards individuals who have a behavioral disorder. And autism is not a behavioral disorder. It is a brain-based disorder. So we have to change the way we approach any kind of challenging behavior we might be seeing. So one of the things that we work here at the Autism Project is change the way we're approaching challenging behavior and develop a more of a coaching model to help support students or individuals on the autism spectrum. So for instance, a lot of times, whether it's a parent calling me or a professional calling me, asking me to come help support, a lot of times it's because of these behaviors that you see up top. Maybe it's a child who has, or an individual who has aggressive behavior. Maybe it's a child who has task avoidance. If a student is in school, they're refusing to do work, they might have us come in. Maybe there's some meltdowns that are happening. Maybe there's some crying that's happening. Sometimes we get called to a classroom to work with an individual who, is having some aggressive behavior. And what we notice is there's also an individual on the autism spectrum, a student in that classroom who's really struggling and, spends a lot of time with their head on the desk or away from the other students. So we will also work with that student. The shift that we're really working to develop here is that when an individual sees these challenging behaviors, so if I'm a professional, I have a student who either is throwing things, maybe saying inappropriate words, what usually happens, right? Society has expectations, and based on our cultural expectations, it does influence the way we approach challenging behavior. So many times what happens is when a student or a child has challenging behavior, automatically the adult who's responsible will jump to consequences, and different, cultures do different consequences. Different education facilities here in the United States have different policies, but a lot of times that can look like timeout, that can look like, going to the principal's office. Instead, what we really promote and are trying to teach professionals, and it was when you see the challenging behaviors that are happening up top, instead of thinking, what consequence am I going to offer to kind of stop this behavior? We try to shift that lens to think, what skill deficit is missing? Dr. Fouad had talked about some of the skill deficits that go along with the autism diagnosis. It's not uncommon for individuals with autism to have intellectual disabilities, or someone to have that social piece or communication challenges. So for instance, one of the things that I was doing recently is working with a lot of pre-K programs here in the United States. We spend a lot of time similar with the red flags, where we're working with the CDC to develop and train professionals on how to identify autism earlier. One of the things that was mentioned earlier is the autism rates in Qatar is 1 in 87. Here in the United States, it's 1 in 54. So the average range in which an individual gets diagnosed with autism, if you're talking about autism where that individual has struggles with expressive language, it's about 3 years old right now on average. For an individual who's on the autism spectrum that has expressive language, we're looking at the age of 6. So still we need to come a long way. So for, let's say in a pre-K classroom, if I'm working with a young child and that child wants to play with a toy, so, they take the toy and they snatch the toy out of that kid's hand. What usually happens in a setting? If I was a parent or if I was a teacher, maybe I'm going to take that toy away and I'm going to tell that child, no, you can't do that. We have to share. Here in the United States, they use a lot of PBIS intervention, which is positive behavior supports. So they use a lot of terms that are related to positive behavior, and they might say that's unexpected behavior. The challenge with that is all those consequences that are we offering this child, we're not coaching the child on what skills they need to do to be successful. And now we're leaving it up to the child to automatically figure out, what can I do the next time I want this toy? So instead, we're trying to encourage more of a coaching model. We would take that toy and we'd give it back to the other child and say, did you want to play with that toy? Okay, can you say, can I have a churn, please? We're not taking into account, does that child have the communication skills to be successful in that moment? Does that child have the social skills to be successful in that moment? You know, Dr. Fouad had mentioned a lot of those coexisting conditions that go along with autism. Sometimes, you know, professionals or parents may forget that the idea to say, I don't feel well, is a life skill. The fact that, you know, I need a doctor, another life skill that a lot of individuals with autism don't necessarily have. So that's something we also need to take into consideration when we're working with an individual who may have challenging behavior. So generally, the typical model that is used in the United States when we're working in classrooms or with parents is more geared towards a consequence model. So if there's a challenging behavior, we will develop behavioral techniques. So classrooms will use things like point systems, where kids have to earn a certain amount of stickers to be able to get a special activity. Or they have these really cool, you know, digital apps now, things like Classroom Dojo, where kids earn points for good behavior. You know, those points can then be cashed in for money, where they can get stuff from like the school store, like fake money. Or, you know, if they have a challenging individual who has, you know, maybe aggressive behavior or is not doing their work, they'll develop a chart where they can earn rewards based on their good behavior. You know, when that doesn't work, a lot of times they resort to things like consequences. You know, sometimes kids, especially when we're talking about middle school and high school age, will get suspended for their behavior. Sometimes they use things like timeout, or they'll have a quiet room where they encourage them to go to the break space. All these strategies that are typically used have the lens where the child has to be accountable for their behavior and they have to figure out how to be successful. What the Autism Project does is we go in and we try to work on how to develop more positive coaching strategies. So think about, what does that individual need to know to be successful before we go into the environment? So let's say, you know, I'm in a school and there's a special activity. Did I prepare the child to let them know that there's going to be a special activity that day? Did I tell them what they can do if they're having a hard time doing that special activity? You know, one of the examples I like to give is, let's say there's a child who has challenges with a lot of sensory input. So maybe loud noises, maybe smells when there's a lot of people, and we're going to go to a party. Well, what does that child need to know to be successful at this party? They need a lot of information. Again, if I was going to go someplace and I didn't know where we were going, I'd probably want to know, where am I going? Who's going to be there? Why are we going? How long are we going to stay? Individuals with autism don't always have that expressive language capability to ask those questions. So what information can I tell them ahead of time to help relieve some of that anxiety and help reduce some of that challenging behavior? One of the things I also always include is what to do if the individual is having a tough time. We all kind of need an exit strategy. So what can we put in place? And a lot of times we teach individuals how to access a break. So for a lot of kids in elementary school, middle school, high school, Musa had mentioned earlier, they help with individualized education plans at the Autism Society. So a lot of times with schools, we build in breaks within their educational plans. So that means if the individual is starting to get stressed out, you know, either the teacher would encourage the student to go for a walk and come back to class, or that individual can actually get up and say, I'm taking a break. They walk and come back to class, and now they're ready to learn. The same thing if we were at a special activity that day or a special assembly that day. You know, we can say to the student, if you have a hard time, let me know, we'll step out and we'll come back in. You know, that's what we like to call pre-gaming. We're giving that information ahead of time. We're developing a plan ahead of time. We're trying to be proactive as much as possible. The model that's currently being used is usually what happens is when things don't go according to plan and there's a lot of challenges. Now, you know, individuals want to say, okay, what can we do to help support the student? Our goal is, let's start supporting the student now to reduce that challenging behavior, to prevent us from getting to a point that that student or individual may have a hard time with their self-esteem. As Dr. Fouad mentioned, there's a lot of that coexisting underlying diagnoses along with autism, and a lot of those are geared towards mental health, including depression, which we're trying to prevent, right, and help build that self-esteem and that sense of self-worth. Especially for individuals on the autism spectrum who have expressive language, sometimes we forget that we can ask the student, how can I help you? You know, not at that moment. We always say, you know, when they're having a meltdown or they're having a really difficult time, that is not a teachable moment. But after the meltdown occurs or after that challenging behavior, You know, it's okay to say, how can I help you next time? You know, what happened? How can I support you? You know, and a lot of students that we're working with, especially when, you know, we have a team of teachers, they're trying everything. And I'll say, well, did you ask the student why, you know, they have a hard time at gym? And they'll say, no, I never thought about that. So it's okay to get that information from the student or individual if they have that knowledge base. They may say, I don't know. They may not have that expressive language to tell you, and that's okay. Offer choices. You know, a lot of times, you know, we think that kids live this carefree life and they get to decide everything they want and they don't have to worry about anything. That's not necessarily true, right? As an adult, I get to, you know, decide what I'm going to eat. I get to decide what I'm going to wear. I get to decide where I'm going to go. For kids, a lot of times, or students, we're telling them everything. We say what the schedule is, when you're going to eat, what you're going to do, you know, how are you going to do your assignment. Offering choices, especially for kids on the autism spectrum, can help reduce challenging behavior. It increases a sense of autonomy and reduces, you know, a lot of the challenges when it comes to non-preferred activities. You know, I encourage teachers all the time, or professionals, or parents. A lot of times throughout the day, there's a set, you know, tasks that have to be completed. It doesn't matter when they're done, as long as they're done. So offer choices as much as possible. You know, for instance, I was working with a parent not too long ago, and, you know, we do a lot of visual supports here that we set up visual systems for schools, for parents. And this parent was having a really hard time getting her child in the bathtub. You know, she had already taken training from us, and, you know, she was saying every time it's time to take a bath, you know, he's running around the house. I have to argue with him. He's screaming, you know. So I said, okay, well, let's build in a visual support that we often use called a choice board, and let him choose when he wants to take a bath. You know, afterwards, a week later, she had called and she said, you know, he doesn't love bath time, but she's not chasing him around the house, which was helpful. So sometimes just offering choices to the individual can reduce some of that challenging behavior we often see. Again, use visuals. You know, the rule of thumb that I often tell professionals is if you're saying something often enough, you can create a visual to reduce how often you're talking. You know, sometimes for individuals with autism, the more you talk, the more we amp them up. And one of the things that I had to learn when I started working with this population, because I love to talk, is reduce my language, to simplify my language as much as possible. Always we want to debrief. So follow up with the individual. A lot of times what happens is when an individual has a challenging behavior, we give them a consequence and then we don't talk about it. So instead we need to model. You know, so especially in the middle school, you know, one of the things we talk about with autism is that social awareness piece. So sometimes the middle schoolers that I work with will make inappropriate jokes. You know, maybe, you know, they heard something on TV, maybe their friends had said something at lunch, and then they go to class after lunch and they tell the joke in front of the teacher, and the teacher is horrified at the inappropriate joke. So she sends them to the principal's office. Well, now what happens? Someone has to take the time to debrief with that student and say, this is why that joke's not appropriate. You know, sometimes, and then maybe do some follow-up education. You know, sometimes the jokes that we hear from our friends are okay to say with our friends, but not okay to say to an adult, and have that conversation. A lot of times we're just given a consequence and we're not teaching. And the goal is to develop life skills. If we don't teach how to be appropriate in that situation, we're going to keep continuing to see similar situations repeat itself. The other thing often that we really try to focus is celebrate all successes. Sometimes we're judging the success in miles, and really we want to judge that success in feet. You know, it doesn't have to be that that individual graduated high school, or that individual got a job, or, you know, that individual is, you know, now that student is toilet trained. You know, sometimes it's the small successes. You know, you were having a tough time and you were able to take a break. Way to go. You know, and we encourage parents to notice those small things. Like for that parent who was struggling with bath time. Well, now that individual, that student or that child can go in the bath and there's no meltdown. That's a success, and we can celebrate even the smallest of things. You know, I remember I was working summer camp, which is one of the things that the Autism Project does. And there was one student who had really severe aggressive behavior. You know, we're fortunate enough in Rhode Island that we have a children's hospital that's geared specifically towards mental health. And he had spent some time and it was a admission, so he was there day and night. He had spent some time there to help with that aggressive behavior. He had just been discharged from that hospital setting, and he was at camp, and the dad was very adamant. He did not think that kiddo was going to be successful at camp because of these challenging behaviors. And we let them know, we work with challenging behaviors all the time. Everybody's welcome here. We will never send an individual home because of their behaviors. We will just make sure they have support in place to be successful. So for this individual, he was getting very upset. I went to go talk to him, and he said, "Shut up so I don't have to hit you." And a lot of times, for a kid to tell an adult to shut up, it's totally offensive, it's rude, but I said, okay, you need some space. I was able to back up, and then afterward, I went to talk to him. And believe it or not, I gave him a high five, and I said, way to keep it safe. You kept yourself safe, and you kept others safe. But then again, I followed up and did that debriefing. The next time you need quiet, you can say, "Can I have a break, please?" Because in that moment, that student was able to keep his body safe, which was a huge success for him. And I wanted to acknowledge that. A lot of times, just because he told the adult to shut up, we don't even see the success. But again, that's that coaching model that we're trying to change the lens in which we view challenging behavior. One of the other things that we're really working to be proactive about, and this is the nonprofit that I had co-founded, and it's called Public Safety Special Needs Coalition, is to work with first responders to better support individuals on the autism spectrum or with other developmental disabilities. So there was a research study that was done years ago, and it found that individuals on the autism spectrum are 7 times more likely to interact with police during their lifetime. The challenge is, while police are trained in mental health, they do not have a lot of autism training. So let's say if a student or a child or an adult is having a really tough time in challenging behavior, oftentimes the police are called and they may be transported to the hospital. Well, what happens during that transport? A lot of the strategies that police are trained in the police academy are not meant to support individuals with autism. So yes, they're meant to de-escalate stressful situations, but a lot of times those techniques only make our individuals on the autism spectrum more stressed. So what we do is we work with first responders, one, to provide training to them on how to identify individuals with autism. So a lot of times I think people have this misconception of what autism is, right? There are individuals with autism spectrum diagnosis who are able to work successfully, who are able to maintain their license. 90% of individuals with autism who do not have an intellectual disability will end up getting their driver's license. Well, what happens when they get pulled over? I been driving for 20 years or so, and I got one speeding ticket. And when I was pulled over by police, it was incredibly stressful for me. So, we have a police officer who's willing to volunteer his time. And what they do is he will schedule a time where that driver on the autism spectrum can be driving with a parent or somebody in the passenger seat. And, if you say, okay, I'm going to be on this street at this time, he'll come in the police car and he'll pull over that individual so they can practice what happens when you get pulled over by police. And by providing that practice scenario, you're teaching the individual how to be successful in a proactive, positive approach. We had one individual that I was working with. He had graduated from college. The first time he got pulled over, he was so anxious that he just continued to drive home, and the police was following him, which, is definitely a dangerous behavior to have. So again, this is another way that we're promoting that proactive approach when we're working with challenging behavior. And again, one of the things that we're really promoting is changing the lens in which we view challenging behavior. We remind professionals all the time, it's not personal. And in addition, it's not that child is, behaving that way to give you a hard time. They're having a hard time. And our role as an adult is help to support and coach that individual to be successful and to be safe.
Thank you, Alicia.
Thank you.
Thanks for your nice talk. And And dear audience, now it's a time for question and answer. And please leave your question in the Q&A section, the right bottom in the screen. So now our three speakers will answer some questions that were sent to us during this our presentation. So please, the Fuad, Musa, and Alicia, please turn on your microphone and video as well. So our first question is about, just hold on, please. Because I couldn't open the Q&A. Okay, Mr. Omar Mohammed, because I cannot open the question from my side, and could you please read the questions?
Yes, Dr. Park, I will help you.
Yeah, thank you.
Okay, so the first question we have is, I have a son aged 15 and diagnosed with Asperger's syndrome. We as parents are anxious thinking about his future. What career options are available for them to be self-reliant?
Is there any specific individual who wants to answer that?
I think Alicia is the one
Okay.
to answer that.
So I will share, I actually have a 14-year-old who's on the autism spectrum, and he is that Asperger's range autism. And I think one of the things that we do here, and Musa had talked about that transition piece. So because he's 15, you should already be talking about what transition into adulthood looks like for him. A lot of times what we try to focus on is to see what are his skills. So individuals with autism, yes, are going to have some challenges, but a lot of times you might find that they have some skills that they're exceptionally well at, and sometimes it's geared towards things that are their special interests. So let's identify what are their interests and what are their skills, and then see if we can look to see if there's a career that kind of match those up. And sometimes we find that they're exceptionally knowledgeable. Just to give you an example, there's one individual that comes to the Autism Project since he was a kid, that he's now an adult. And since he was 5, if you name any sports player, he can tell you the statistics of that player. So, he may tell you, how many home runs this person had, how many RBIs, like in baseball. So now that individual is pursuing a career in sports, and, he's doing exceptionally well because it combines an interest with a skill set. So I think that transition team is definitely going to be helpful in finding a career for that, and for your child to be successful.
Okay, our next question is about the Qatar has been leading autism research in the Middle East and North Africa regions. So could you please elaborate on the availability of autism-related data and research from other Middle East and North Africa countries? So probably I think Dr. Fawad or Musa, could you please comment on that?
Actually, during our prevalence study, we did a comparison on the Gulf states, for instance, and even here in Qatar, before we did our prevalence study, the number, they used to be 1 per 3,000. And for instance, in the United Arab Emirates, the number is also around 1 in 5,000. In Oman, actually, they didn't do screening. What they did in most of these countries is to create the ratio or the prevalence rate, the number of those diagnosed with ASD, and according to the number on that age group. And that one is not a real prevalence study because there are so many missed cases in the community as what we found. For instance, when we screened more than 9,000 children between the age 5 to 12 attending the ordinary public schools, we found that 1 in 87 of them affected with ASD when we did the screening and then we did the ADOS. So actually we cannot compare or say that the rate in that country, this is the rate. Even if you see the United States, of course, in the US, they review the records from the education, I mean, the schools records and those, the centers and hospitals, etc., who do the diagnosis, which means that they didn't do screening. Now there are some studies going on that the US, they are doing the same way that what we did. I remember South Koreans did the same. The Mexicans did the same. I mean, screening, where apart from screening, you cannot tell exactly. You can say that the rate is this, but it's not a real one. The WHO usually says that the rate between 0.6 to 1%. This is a generalized one. So we would say that it's almost similar to what we found. If they do a proper prevalence study, the rate is going to be almost near to what we found because, you know, it's the same culture, especially in the Gulf areas. Yeah. Of course, I have the numbers. I got the numbers. If I can bring it up for all these countries. I mean, Gulf countries, North African, which mean Egypt, Algeria, Tunisia. I have these, but this is the WHO. It says between 0.6 to 1%. And what we found, it's almost similar. And by the way, regarding the US prevalence, the US prevalence rate is among those children age 8. Well, what we did, we found almost 1 in each 66 here in Qatar affected with ASD among the same age group, which is 8 years.
Okay, thank you. And then there are some medication that can be used for the treatment of autism. And can you give more examples and how effective these medications are?
You see, can I answer?
Yeah.
See, regarding the medication, it depends on the case. For instance, for hyperactivity, they give certain medications. For depression, it's different. It depends on the signs and symptoms of the affected, and mostly depends on actually on the comorbidities that goes with ASD. But there is no specific treatment or medications which we can generalize it for the ASD. And it depends. For instance, for depression, we give antidepressant. For hyperactivity, we might give for instance, I have some, if you like, I can mention, but it depends on each case. Usually the pediatric psychiatrist, the one who evaluate the condition, and they can prescribe the correct or the best medication for that individual. We cannot generalize. I mean, we use this medication for every autistic child.
Okay, thank you. Thanks again. And then is there any other spiritual learning services like how to pray or read Quran. So probably Mr. Musa, I think, could you please comment?
Oh, yes,
on
yes,
this?
we can teach. They have no objection and no obstacles to teach them that, but we need to use some kind of behavioral strategies. I mean, in advance, and use maybe coaching strategies, as Alicia mentioned. We should coach them more than like when we use behavioral strategies. It jumps to my mind that it is a kind of controlling or punishment of behavior. That's right. So we should work with them on how to integrate themselves in such activities, which is, and sometimes very abstract. They cannot understand it right away. They need to have kind of the first time, second time, and in advance you have to prepare them for the things that we will see a crowd of people. This mosque or the masjid will be full of people. Somebody will touch you, you know. We could use pictorial, let's say, help on that, like PACS. We use pictures to teach them steps. Well, they are very ritual people. When you go to instructionalists, like step 1, step 2, step 3, step 4, they can understand it very well. And we use this strategy actually in employment. Now, with Qatar Airways, we have employment, let's say, experiences. With North Atlantic University here, college, we have also that. We use it with an adult with autism. Wow, it was perfect. So I think there is no objection to teach them those and to adapt such things. It's okay to do it. And it's very easy. For Quran, wow, some of them are very, very auditory learners. They can recite and they can memorize the whole surah of Al-Baqarah, 286 verses in 1 hour. And they can repeat it again. I have children who are now adults, 20-something years. His name is Ahmed, I remember him. He just listened one time for the whole Al-Baqarah, Surah Al-Baqarah, verses Al-Baqarah is 286 verses. 1 hour, he memorized it. It was amazing.
Yeah, amazing.
So there is no objections or no thing to obstacle or to stop them to learn that.
Mm-hmm.
Even in personal opinion, I tried that with some kids and other. They like imitation. They do have some problems in imitation.
Mm-hmm.
Yes, but they can do it. Not they are lack of, yani zero, null. No, there is no null or zero thing. It's not just a lab test. You have like parasites or, you know, in lab test in the blood you can find. No, they have a lot of these things, a lot of skills. And some of them, as Dr. Fuad mentioned, they are high functioning. High functioning.
Yeah, thank you, Musa. And our next question is about my brother is diagnosed with ADHD. And is there any link between autism and ADHD? And Fuad, probably, yeah, you can give some
Actually,
comments.
as I mentioned before, that around 50% of ASD individuals, they usually have ADHD. And it depends on, you see, for instance, girls, they have more in the attention deficit rather than the hyperactivity part of ADHD, while the male you know, individuals, they are more hyperactive. Regarding, so there is a very, very close link between these two. And even sometimes, you know, it's very difficult to, in diagnosing ADHD and to see whether autism, ASD is associated with. It's a very, very near, you know, it needs a lot of experience because sometimes we miss the diagnosis. And as you know, the diagnostic criteria, they are sometimes overlapped between these two. But the main important issue is the repetitive behavior. You know, usually the ADHD people, they don't have that, while they share some other, even some other comorbidities among the ADHD which sometimes let us think that they might have some autistic traits goes with it. So, but in general, almost up to 50% of the ASD individuals, they do have ADHD, and especially during the early years of life. Of course, when they grow up, the symptoms, it gets better by age.
Thank you. Yeah, thanks for answering all these questions, and then again for your great presentation and talks. I think it was very great pleasure to have you all together in this our webinar today about autism spectrum disorder. So I think this could conclude our webinar today, and thank you all for attending, and we hope you enjoyed and learned from this webinar. Please hope you stay safe and have a nice day.
Thank you very much.
Thank you.
Yeah,
Thank
bye-bye.
you very much. Bye.
Thank you. Have a nice
Thank
day.
you.
Yeah, bye-bye.
Bye.